really happy to be here, to know you all, to finally meet your community live in person that I've been hearing so much from Tanya. I'm really happy to be part of this beginning of this, or this one of these big steps of this community, and hopefully being present in several of these. My name is João Pita Costa. I am a researcher. I've been with the Joseph Stefan Institute for a long time. I'm part, or mostly contributing to the International Research Center on AI under the auspices of UNESCO IRCAI. And I'm going to talk to you about maybe another perspective of artificial intelligence that is, I think, and not only me, I think that's very useful, meaningful for health community, both in health researchers and patient associations, in the search for the appropriate information. So a few years ago, we started with a project on big data for public health and public health decision making that was focusing a few diseases, not rare diseases, unfortunately. We were working together with IBM Watson, that was in charge of some social media, with big institutions on the context of health, with several public health decision makers, including Public Health England, the Basque Public Health Institution, and so on. And there we learned a lot about meaningfulness and usefulness of artificial intelligence technologies in the context of the appropriate usage in health. And we're mostly working with at the time news and research papers. We had quite a big corpus, more than 10 years of news gathered worldwide. And we were working and are still working with the Medline dataset. Is the open dataset underlying PubMed. PubMed being the biomedical search engine that we all know. Roughly now around 29 million biomedical articles, so lots of knowledge, and in a big part hand annotated knowledge. So as maybe many of you know, one of the richness of PubMed and Medline is the fact that there is some sort of hierarchy of medical categories that medical doctors are annotating by hand to say what are the articles about. So we can use that metadata and use that structure on the knowledge to, for example, do automated literature review, which is in a way what we're going to talk a bit today, and the different perspectives on that. Literature review, anybody that starts to write a paper on healthcare knows how this is one of the first one of the first initiatives, and one of the first things that we need to do. And of course, the one of the important things, when already long time ago, even much a long time ago, before I met Tanya, we were talking on how multilingual technologies that are independent of the language, that can understand text independent of the language that it's written, they are capable of having some sort of automated overview of big bodies of knowledge, could be very relevant for rare diseases, for example, where it's difficult to find information, because that's where this kind of methodologies and technologies are maybe more useful. And when we looked into, with working with Tanya, when we looked into the 16 rare diseases that we were targeting, the first approach is to try to understand how rare they are in the data, and there are many cases that are not surprising. You see the tables here. There are a few improvements that we can do. This is like a very rough thing. So basically, I have the languages in Wikipedia, the first numbered column, that will allow you to to go from one language to another. These are somehow indexes on how multilingual is the capacity of you to, for example, read the news in all the languages. And so if, for example, Kleefstra syndrome has 8 languages, so there is some multilingual capacity, but for example, compared with the Dravet syndrome is much less. It's 17. Then the ones that are more related with genes are more difficult because of that dependencies that we have for these multilingual capacities. So we are able to, and then of course the presence in the news. It would be important to understand also what's the coverage of that. This is the news on last year, so across 2022. Some diseases are much more present than others. Some of them are really sometimes not even present much, or meaning they are harder to find, because then we can refine those searches. We can add symptoms, we can add characteristics of the diseases, and we can do much more work that would maybe make more sense. Now, looking at scientific articles, we have maybe a little bit of a bigger problem, because the rare diseases. So in the MeSH categories that are the medical categories for the Medline, they are defined by the American National Health Organization, and they are distinguished between let's say major topics, let's say, and topics that are a bit secondary, that are more used to, that are not categories by themselves, but are more used to be complement. And in several cases, what happens is that we identified that some of the syndromes are not even medical categories. So that means that they are not used for the hand annotation. That means that it's harder for us to search for this in the research using these automated classifiers. What we're talking about is a structure of more than that goes across these 28 million articles, that has 13 levels of depth, that has 16 categories, and that's what we mostly played with, because unlike searching for one key phrase or keyword, you are searching for the topic that really is part of the article. So you have much more. If you're searching for a concept, for a medical category in your search, then you are really getting articles and results that really matter for that topic, not just that the disease was mentioned somewhere. So of course, it's much more relevant. And having all that data, it's important for us to understand, to use it also in the dialogue with medical researchers, with patient organizations. So the usage of interactive data visualization that Alenka went through, Tanya, is very important. Not only for us to go around and play with it and it's nice, but to help us to help it to support us our dialogue on that data and what we can do with it. So using that interactive data visualization is for prototyping, for creating tools that can be interesting for you. Now, another thing, and these are things, I think you'll probably get the slides later on. There are some links that you can visit, some papers you can read. This is a system that we have for literature review, where you can just use the search query either to search for directly on the key phrases, and then it goes and gives you all the results on the Medline. But more than that, you have a clustering, word clustering there on the side that you can go around and you can specialize your research. This is automatically generated, so you can refine your literature review. And while you're doing that, you're also changing the position of your search. You see, like already in the 5th, there was one that was before in the position 130. So this is really helpful to try to understand. Is one example of data visualization that can help literature review. And not only can help literature review in scientific articles, it can help literature review in news, in medical reports, in legislation. Why not? We were talking about policies just before at coffee time, and how important are this understanding of the policies associated with different diseases. So if we have the capabilities of understanding how this automated understanding of text, we will be able to also use this for different perspectives. We can also use this mesh categories, these Medline categories, and we have again some demo that you can use to provide you an automated classification of the text. In this way, in a way that our algorithm, nearest centroid classifier, learned with the PubMed articles the classifications for each of the. So it's simple. So you ingest the articles, the scientific articles with the classification, the medical categories assigned to them. And so the algorithm learns more or less how to assign medical categories from MeSH, of course, not just something invented, to any text. And then you can automatically classify new scientific articles, news, reports. Need to be in English because the Medline is only in English. But then provides you how similar the text is, because it's based on text similarity, how similar a certain article on Kleefstra syndrome is to articles that were assigned those subcategories. So this is quite it's shown to be in the context of public health quite relevant. And of course, if the algorithm is learning in the context of the language and methodologies of scientific research papers, moving that type of classification to understand news, for example, medical reports, legislation, is different, and you lose a lot on the quality of the classifier. But the signal that you get, it's already quite positive, and there's already quite good results that you can do with it. One of them that we did was some of us, you heard about the news engine event registry that is collecting and visualizing worldwide news. What we did was to exchange the classification that it had in its instances to have some sort of like a health news engine that we would be able to search. Instead of using concepts of Wikipedia, of some other classifications, we actually use the MeSH headings, the medical categories of Medline, to be able, like we do in PubMed, we use those categories to search the news, and like we search the news, we could use those categories to search legislation, policies, and so on. And we are not keyword searching; we are searching for in the context of text similarity. So this can be quite relevant. There is some sort of there's quite some interaction between all these tools, so they are not really separated. The idea is to have some sort of like a integrated workflow that goes from the interactive data visualization, prototyping, and dialogue with patient organizations and medical researchers and policymakers. Why not? To exploring these different perspectives in the uses of the classifier and the explorer and in the context of literature review. Now, yesterday, Mitya was talking about the SDG observatories. I'm very much engaged on that. So this is a methodology that these methodologies I've been talking about today can, of course, be refocused to several things. But in health, we have tried these technologies and the usefulness of those validated with different public health institutions and medical researchers for diabetes, for infectious diseases, and mental health. We have, at the time, we were closing the project when COVID struck Europe. So we were able to fastly refocus some of these to actually provide the support to the people engaged on these initiatives. And we also have seen the challenges and the opportunities on that refocus. And that's based on that also that what we're bringing, hopefully, to rare diseases, very much with the leadership of Tanya, but hopefully with this contribution that I'm happy to bring. And so bringing in a whole together indicators, news, social media. We didn't talk much about it, but there's much that we can do, and we've been doing on this. Science and patenting, citizen science, legislation, and education. Education for rare diseases, for parents, but also for society and for better understanding on that. I think we are now in the end of time. I just wanted to say that the key is not only these tools independent by itself, but what can they tell in the interaction between each other, when we are looking for certain priorities in your communities, through the indicators, through the news, through the social media, the public opinion, the following groups, focused groups, to understand the sentiments in certain aspects of news, or to explore worldwide practices based on research, based on indicators, based on news, that can interact and that can bring all together these perspectives on the several rare diseases and the common points and bring this up. Last but not least, I wrote a few weeks ago, I don't know, something very naive. I mean, presenting this in your community is very naive, but how maybe artificial intelligence can contribute to this. This is part of the discussion forum of Software Forum, European Commission initiative. You're all welcome to read more of what I've been talking about there and participate on that discussion. Thank you very much.